In this video, we'll talk about cheilitis. What is cheilitis? Cheilitis is inflammation of the lips that is either acute, meaning very short-lived, or chronic, something that's long-term and continuous and persistent. There are many different causes for cheilitis, even though sometimes cheilitis can be almost indistinguishable, irrelevant of the cause, and that can pose a serious clinical diagnostic challenge and treatment challenge for those involved in caring for cheilitis. In this video, we'll discuss various types of cheilitis, how to approach the problem, and what are some of the best treatments for the various types of cheilitis out there. Before we get started, don't forget to hit the like and subscribe button, share these videos with the people you love, and don't forget to hit the notification bell to get notices of future episodes. So cheilitis, as I mentioned, is irritation or inflammation of the lips. There can be many causes for cheilitis. Specifically, there are the allergic contact cheilitis, which is a result of application or contact with an agent that is causing an allergic reaction on the lip area. That could be associated with lip gloss or lip balm products that contain fragrance or other ingredients to which the user is allergic. The allergies can develop out of nowhere, meaning you could have used the product all your life or for many years, and then the body can become sensitized to one of the ingredients, and you can develop cheilitis or irritation of the lips, meaning the lips can become very red, very chapped, very irritated, sometimes itching, burning, or even painful. And there could develop some painful cracks on the lips that can lead to bleeding. So it could be pretty mild or very dramatic, really depending on the frequency of use of the allergen or the severity of the allergic reaction. There are many different factors that feed into how the condition presents itself. But the bottom line is that once that happens, no matter how quickly it took to develop the allergy, whether you were allergic before you started using the product or developed an allergy as you were using the product all along, obviously discontinue the allergic contact trigger, and in many cases, there could be a need for using a topical medication to address the irritation. Specifically, topical steroids are highly effective in addressing allergic contact cheilitis and its close relative, irritant contact cheilitis, in which an agent that is causing irritation through disruption of the integrity of the skin or cell damage and presents itself in a very similar way to allergic contact cheilitis, meaning redness, irritation, itching, burning, and even pain with cracks on the lips, really depending on the severity of the irritation. Much like with allergic contact cheilitis, with irritant contact cheilitis, the irritating agent needs to be withdrawn, whether it's a lip balm product or another product or some sort of a scrubbing or exfoliating agent that you've been using on your lips. That needs to be withdrawn. Obviously, we need to withdraw the inciting agent, stop the assault on the skin, and in many cases, resort to using a topical medication to address the irritation that was formed over the lips. Another form of cheilitis is candidiasis. That's a yeast infection of the lips that can happen when yeast overpopulate the lips and can lead to severe inflammation of the lips. That condition does not respond to steroids. It will actually respond to anti-yeast medications, whether it's a topical medication like nystatin, for instance, or in the more severe cases, it could require oral medication that's antifungal medication to address the infection and get rid of the candida to resume normal business as before. In many cases, the residual irritation that results from the initial infection may require treatment with a topical steroid once the infection has been cleared to get things back to normal. The last variant of cheilitis that is actually pretty common, especially in older people that have been sun exposed, is actinic cheilitis. Actinic cheilitis is irritation of the lips that's chronic in nature and happens over sun-exposed areas. It's a result of sun damage, and this can result in chronic inflammation of the lip. That chronic inflammation can actually be associated with formation of what we call actinic keratoses, which are raised precancerous bumps over the lips, and formation of skin cancer, specifically squamous cell carcinoma. So that needs to be monitored very closely. And actinic cheilitis is treated quite differently from the inflammatory types cheilitis and from the infectious types cheilitis, as in the sun damage needs to be cleared and addressed in some way. Some cases respond to liquid nitrogen, while other cases may respond to treatments such as photodynamic therapy, which is an application of a photosensitizing agent onto the treatment area, and then treatment of the area with a special kind of lamp that destroys a lot of the cells that have been damaged and allows the area to restore some semblance of normal tissue, getting rid of the sun-damaged tissue over the area. In all the cases that I've mentioned so far, it is important to mind the skin barrier because cheilitis is a disruption of the skin barrier, and in many of the cases, especially the inflammatory cheilitis, application of an occlusive might be a good idea. Specifically, white petroleum jelly or my shea butter balm can make a huge difference for restoring a semblance of the barrier that is lost in the throes of chronic inflammation, and that can help restore the normal function of the skin over the lips and getting them back to normal. If you've enjoyed this video, share, like, and subscribe. Put a comment in the comment section and tell me what kind of cheilitis do you think you're suffering from and how have you been able to address it. Also, don't forget to hit the notification bell for notices of future episodes. More great content coming your way right from this channel. Thanks for watching and God bless.